Welcome, everybody. Just giving a minute until everybody arrives. So we'll get started in about 60 seconds. Erica, nice to see you.
Nice to see you too. Thanks so much for having me back.
You are welcome. I like that book in your background.
Thank you very much, Dr. Howard Schubiner.
So Dr. Schubner's new book, Unlearn Your Pain, came out last week. So he's our colleague here at Cormendi and a mentor of mine for many, many years. And he worked on this book for 3 years, 4 years, 5 years. Like it's like the sum total of what he's learned in the mind-body medicine space over 2 decades
Hmm.
worth of time. And anyway, so Nirali will put the link to the book for those of you who are interested in it and on sale through the publisher and anywhere that you get books, and a great addition to the literature on mind body medicine. And then he's normally in Detroit, Michigan area, he's going to be here in Chicago on Friday signing the book and talking with people. So anybody who's here in the area, in the Chicago area or nearby, Friday, 5 o'clock Central Time, Dr. Schubiner will be here talking a little bit and doing a book signing. So anybody who is interested, Nirali will put the link into the chat there so that you will know how to get in touch with us if you're interested in attending. So that'll be super fun, and we are super excited. Like I said, he's been working on this for years, and so great to have that come up. Everybody's here. We will go ahead and get started. Erica, nice of you to be here with me today. For those of you who don't know me, I'm Dr. John Stracks, a physician with an office in the Chicago area and worldwide on telehealth, who specializes in mind-body medicine. I'm here with Erica Walker, who is a therapist and pain coach in our office at Cormendi, who specializes in pain reprocessing therapy, which I will call PRT. She has been doing outstanding work in this area for well over a decade, has treated thousands of patients for mind-body medicine disorders, and has agreed to be with me in these series of Lunch and Learns to talk about the fundamentals of PRT. Erica, thank you for being here.
Thank you so much. I'm happy to be back.
And so we were here about a month ago and talking about an overview of PRT. And we thought, you and I, and discussing this ahead of time, thought that a quick overview would be helpful for people. And so what we started to talk about last time, and then we'll move on into next steps. But we started, if I'm correct, with an overview about just what PRT is, correct?
Right. So PRT is designed essentially to help break the fear pain cycle. So if you think about it like a loop, right? The fear is fueling the pain, and then the pain fuels the fear. And we can get stuck here, but we can also get out of it. So PRT offers, a lot of strategies for how to respond differently to unpleasant sensations, pain in the body, or and PRT can be used for any mind-body symptom.
Mhm.
There's a lot of literature on more musculoskeletal, like back pain, joint pain, but we've seen people with, kind of every symptom under the sun. If I had to list all of the ones that I've experienced, I would literally have to start with my head and just work my way systematically down my body.
Mhm.
So we can get out of chronic pain. It
Mhm.
is doable. It's not easy, but it's relatively simple at the same time.
Mhm. And so when we were talking last time, we talked about three specific strategies that you tend to recommend.
Mhm.
Essentially, like as soon as you start to work with people, right?
Yeah, yeah, really right out of the gate, I want to start off with an evidence list, especially if people are on the fence. I think of this like chatting back and forth and getting into like an anxiety argument. Is it structural? Yes, no, yes, no. And we're going back and forth. And we can spend lots and lots of time doing this chatterbox in our head. It is, it isn't, it is, it isn't. And when pain goes up, it tends to pitch more towards the idea there's got to be something structurally
Mhm.
wrong with me, right? So
Yep.
with the evidence list, I'm asking people to literally write down and bullet point what makes you think that this is mind body, right? Where's that information coming from? Is it unremarkable testing? Is it this shows up when I'm under a lot of duress? This came about after we had our first child. What are pieces of evidence here that are supporting the mind body? But we're not going to go fully into that today because we already did
Mhm.
these three
Yep.
in our previous video, so we can drop the link, right?
Right. Yes. So we put the link in the chat and people can find that on our YouTube page. And so keeping an evidence list, keeping our understanding about why we think these pain issues are more related to psychology than anything wrong in our body. And then
Mm.
we also talked about the ability to keep track of our wins and when we're doing well. And so how do you explain that to people when you first see them?
So this is one of my favorite things because as humans, we are phenomenally skilled at being oriented towards threat, right? We're survival oriented creatures. Some people call it a negativity bias. I don't really love that phrase because it kind of sounds like that means I'm doing something wrong.
Mhm.
We are organically designed this way. We need no more practice with keeping track of the things that we don't like. What we usually need practice with is keeping track of the things that go well.
Mhm.
So this could be, it could even be something that feels like saying it out loud might feel small,
Mhm.
but it's big to me and
Mhm.
it's big to them. Like I tied my shoes without help for the first time in a year,
Yep.
or I did an activity that I didn't think I could do, but I did it. And even if it wasn't perfect, that's okay because
Mhm.
we're just steering the ship towards wellness.
And then how do you help people understand that those are important even if it doesn't feel important, right? So that was a really good example. I tied my shoes without help for the first time in a year. A lot of my patients over time would be like, all I did was tie my shoes. Like, how is that a win?
Yes, yes, and this happens a lot where I'll give the homework of I want you to keep track of your wins this week, and invariably people will come back and they'll say two things, and so I try to flesh that out a little bit more,
Mhm.
right? Did you sat and watched a movie with your partner and you didn't get up the whole time? That's huge.
Mhm. Mhm. Mhm.
These things are people who are in pain. These what they might think is a little win to me is critically important in the healing process.
And so one of the things that you do with people then is you help them to see that, right? Because people, like you said, we're so good at looking for threat. We're so good at looking at the negative.
Mm.
That it takes a lot of intention to find the positive.
It does. It does. That's why I have people either type it out, write it out, but that's how I like to start a session. So that's pretty much like the homework from the first session is already keeping track of your wins.
Mhm.
And so then I want the client to start off the session with what has gone well. Now, there's certainly going to be space to talk about what's maybe not going ideally
Mhm.
right now.
Mhm.
But I want to kind of encapsulate this with because those wins are going to help you to pitch into safety and out of fear,
Mhm.
right? But the mind is going to go kind of back and forth like this for a while. Am I safe? Am I not? That's
Yeah.
just part of being a human.
And so when you're working with people individually, is that literally how you start the sessions by finding out what went well for people since last
Yep.
time?
Yep. That's what we start with.
I like that. I like that. And then the other thing that we talked about last time was the three C's, which is a specific strategy that you developed over time. And so, can you give the brief overview to that too?
Okay. So this is the three C's. I'm going to kind of jam through this because we did a lot on this last time.
Mhm.
So it's called catch, compassion, carry on.
Mhm.
So we can't change something if our thoughts are just running the narrative, right? And we're buying into that narrative. Oh my gosh, this is true, right? Because we would never go around saying everything that I think is true. We know that's not the case, but we get really caught up on the thoughts that scare us the most. So we
Mhm.
want to start identifying them. Oh
Mhm.
my gosh, that's that scary thought that I've had. That's that catastrophic thought that I've had. I've had it a million times. I'm just going to notice it without getting into battle with it.
Mhm.
Right? Old school psychology talks about thought replacement.
Mhm.
Get rid of the negative thought and add a positive thought.
Mhm.
It's too much work.
Mhm.
It's just too much work.
Mhm.
I'm going to simplify it. Just, aha, there's the thought,
Mhm.
scares me. This is the compassion piece. I know this looks kind of silly, but I actually have clients who do a physical thumbs up for themselves.
Mhm.
Of good, I caught this.
Excellent.
I intervened on my own behalf. Good, I caught this when I was, 32 hours down a rabbit hole with it, but then I figured out, wait, this is just scary thinking. It doesn't mean that it's true. I
Mhm.
don't have to engage with this scary thought.
Mhm.
And then we want to be kind to ourselves,
Mhm.
right? Because what people want to do, this is the hardest part of it,
Mhm.
right? What people want to do is go, oh my gosh, I'm having that negative thought. I'm not supposed to be thinking negative thoughts. Now it's all my fault. Now I'm doing it to myself. So we don't want to kick ourselves while we're down,
Hmm.
right?
Hmm.
So, mm, good. Getting better at this.
Yeah.
I'm on the right track. It
Nice.
will be the hardest part. This
Right.
is not organic to us.
And so if my negative thought is I'm never going to get better, I
Mm,
see that. I got to see that I'm saying it. I
mm,
catch myself and then say, like, it's okay. It's okay that I have that thought. The thought isn't necessarily true.
right. Right. And then the carry on part, just for the simplicity of this talk today, I will stretch this out more when I'm working with somebody individually,
Mhm.
is just what's happening with my breath,
Mhm.
right? The breath is shallow, the heart's going to be a little faster, muscles are going to get tense, right? Because the brain is preparing us to go into a fight or flight mode
Mhm.
so that we are safe,
Mhm.
right? This is a really primitive function, and we're grateful to have it, but we mostly don't need to be in a state of fight or flight.
Right, right. Got it. Got it. Got it. Good. And so that's what we talked about last time. So the evidence list, keeping track of your wins, your specific strategy of the three C's. And then you and I did a video previously, I can't remember, 6 months ago or a year ago, talking about somatic tracking, which is an exposure technique.
Mhm.
And so
Yeah.
that full video is available, and Raleigh can link to that as well. But let's talk a little bit, or just review briefly, what exposure is, why it's important, and why we spent all that time talking about somatic tracking previously.
Mhm. So essentially, exposure is confronting the things that scare us. Exposure work is challenging. It's also incredibly rewarding when you
Hmm.
get the hang of it.
Hmm.
Right? So with somatic tracking, this is what is called interoceptive exposure. You're welcome for the nerdiness.
Interoceptive exposure.
Interoceptive exposure, yes, it has a clinical name to it.
Interesting. Okay, got it, got it. Yeah.
Right. So this is paying attention without judgment on purpose to the sensations in the body that we find scary.
Okay.
So it sounds kind of counterintuitive, right? Because
Mhm.
the goal here is for the pain to go away.
Yes.
But in order to do that, we've got to get closer to it.
Okay.
I know. It's
Um,
not easy, and not everyone is ready to do that right out of the gate.
What if I don't want, like, say I come to you and I've got terrible back pain and I hate it, right? I just don't want it to be there. I want it to go away.
Right.
And you tell me to feel it. Like, I don't want to feel it.
Hmm.
Can I
Hmm.
get away without feeling it?
You're trying to ask me a trick question here? No,
Okay.
is my answer. Is because we have to be able to learn how to reduce the fear
Hmm.
around the sensation, because otherwise we're going back to the beginning here, right? The fear pain
Hmm.
cycle.
Hmm. Hmm.
Mhm. And so somatic tracking gives us an opportunity to take a break,
Hmm.
all of the judgment and the fear and the fixation in a negative way. And
Hmm.
we can just be with that sensation while we're breathing,
Hmm.
noticing when it's moving, when it's a little louder, when it's a little bit quieter. And
Hmm.
then people will often say to me when in a first session, they'll say, I tried somatic tracking, but I think I'm doing it wrong.
Hmm. Hmm. Hmm.
You hear this all the time, right? I
Yep.
think I'm
Yep.
doing it
Yep.
wrong.
Yeah.
And the only way really to do it wrong is that I've got to make this go away, because that already hasn't worked,
Hmm.
right?
Hmm.
So we've got to shift gears and come towards the body so as not to be as scared of it. So, if, for example, if someone is scared of escalators and they stop riding escalators and they don't ever want to get on one again, now they don't have to,
Yeah.
but the only way to get beyond the fear is to ride the escalator, is to
Hmm.
be with it,
Hmm.
reduce the intensity in the body. So I really walk people through. It's an entire session for me to go through somatic tracking and try it. And then we just kind of dip our toes in and see, are you ready to do this? Are you not? Do you like it? Do you hate it? And then we can shelve it and come back to it.
Hmm.
If it's too much, if the fear is too high, then we've got to work on the fear first.
And how quickly do you bring this up with people? And so we talked last time about getting started and people meeting you and what to do initially. Do you start to bring up this concept of somatic tracting, or what do you call it, interoception?
Interoceptive exposure.
Does that come up in, like, pretty quickly when you're working
Yeah,
with people?
usually.
Okay.
Usually. And we're communicating with one another. So we're dipping our toe in.
Hmm.
Let's see how this goes. And if the intensity starts to rise, then we're going to just get really calm and slow things down together, right?
Yeah.
And it's easier to do somatic tracking when you're with somebody else because the client is just listening to
Right.
me and they're not anticipating necessarily what I'm going to say. So they're actually paying attention to my words,
Yeah.
which can be really soothing and calm people.
I think one of my favorite strategies with the somatic tracking too, and I know that's not necessarily the focus of what we're talking about, but sometimes people will come in and tell me about how much they hate it and how terrible it is. And I say, how do you do it? And they're like, well, I know it's so important. So I sit down every morning and I do this for 30 minutes until I can't take it anymore. And I was like, okay, great. Like, let's try 3 seconds.
Right, exactly, exactly. Like we don't, I call it like you don't need to somatic track your face off, right? Because it's still having that same intense pressure.
Hmm.
Shifted the pressure to I have to heal and it has to happen right now.
Yeah.
And we hear this from clients all the time is how long do you think this is going to take?
Hmm. Hmm.
And we
Yeah.
don't know the answer.
I tell people, right, we'll move forward as quickly as you can and as slowly as you need to. It's different for everybody, which is hard, right? You and I both want everybody to be better in 24 hours. I don't want anybody to suffer at all. And I
Mhm.
know that there's a process to it. And for some people, that process is a little bit longer. And for some people, that process is a little bit shorter. I think that's one of the advantages of talking with me or talking to you is people will come in and say, like, I know it's been 6 weeks and I'm not better and I'm slow. And I'm like, no, I'm thinking about how quickly you're moving forward. And so, with so much information out there that this should be instantaneous,
Right.
so many people, it's a process of getting better.
It's a process, right? And we talked last time about the what is probably even less important than the how. So we're going through specific strategies here, but the how we bring the energy to something like somatic tracking
Mhm.
is if we're if we're closing our eyes and we're like I'm doing it, where's the pain, what's going, then we start going into that really fixated space
Yeah,
again. So we
yeah,
want to shift that, and it's okay that it takes time
right.
for that intensity to shift.
Right. And because when we're not feeling well, we spend so much time focusing on not feeling well. And
Yeah.
do you ever try to bring people to different sensations in their bodies?
Yeah, yeah. So let's say they're having, neck pain or something like this, and we're noticing it. And as we're doing somatic tracking together, the
Mhm.
pain starts to get louder. Then I'm going to take us to another place in the body that's more neutral,
Mhm.
right? So a lot of times that's going to either hands or feet, or it
Mhm.
could be something else. It could
Mhm.
be touching your face,
Mhm.
right? Just
Mhm.
notice what this feels like. So we're
Mhm.
kind of titrating back and forth so that this is more tolerable.
Mm-hmm. Right. And because when there's just pain all the time, it just gets so big that we
Mm.
forget there's other parts of our bodies that feel okay or neutral or there's things that feel
Exactly.
okay.
And people do tend to enjoy the distraction of mimicking walking, right? So curling your feet, and then I'll start calling out parts of the body. So notice this ligament area here and how it
Mhm.
tightens.
Mhm.
Notice your ankle and how it gets a little bit tight.
Mhm.
Your calf, your
Yeah.
knee might be activated.
And so there's a whole separate video that we have on somatic tracking. And so the introduction and then the exposure. And so what happens next? What else is involved with the practice of PRT that helps people to move forward?
Mm. I like setting goals,
Hmm.
right? So right out of the gate, probably in the first session, I'm going to ask, like, what are you doing for exercise?
Yeah.
What might you be avoiding? What are activities that you used to enjoy and are now avoiding?
Hmm.
So there's several types of exposure that I do, and
Yeah.
we've talked a lot about the walk jog,
Hmm.
right? So we get tons of clients who are fearful of running, and this could be from any sensation in the body,
Hmm.
right?
Hmm.
And so if their goal is to get back into running,
Hmm.
oftentimes what I'll do is I'll just have them put on headphones so we're not even on Zoom together. We can be, but it's kind of challenging. And so I'll have them we're walking for 1 minute,
Hmm.
and then the jog part is literally the slowest jog you've ever done in your life. We want to know 100% there
Hmm.
is zero way that you can harm yourself while we're doing
Hmm.
that. So
Hmm.
do like a minute of walking and then 4 steps of jogging and then back to walking. Right. So
Hmm.
we want to introduce these things in a way that's reasonably palatable.
Hmm.
Otherwise, we don't want to re-traumatize anyone.
Hmm.
right?
Hmm.
So it's
Right.
not just you have to go out for a run, right? We don't want to go from 0 to 10. It's
Hmm.
too much. And I
Yeah.
know a lot of people think that that by pushing themselves
Hmm.
that's part of the healing process, but that's still that intensity. That's still
Right.
somatic tracking your face off, right?
Right.
So we start out slow, and if someone's afraid of using a machine, they've avoided their recumbent bike or something, let's say.
Hmm. Hmm.
And what we'll do is we'll do it together,
Hmm.
right?
Hmm.
So all we're gonna take a few minutes and just describe the machine itself,
Hmm.
right? Just there's the wheels here and the things here and the handles here.
Hmm.
Great. Breathe, and then I have them get on it, and we're just gonna hang out on it,
Hmm.
right? We're just gonna talk about, and then once we start to move, it's kind of like raise your hand if you're noticing some anxiety
Hmm.
coming up,
Hmm.
and then just pause,
Hmm.
right? So again, we want to titrate
Hmm.
with exposure.
And
So, right, so like 30 minutes of somatic tracking is pretty excessive, I
yeah,
would say.
yeah,
Yeah.
yeah, without a doubt. And I've known you to like literally be on a call, be on a Zoom call with somebody as they're working out or going out for a walk or a jog, correct? That's part of
Yeah.
what you will do.
Yeah, and I think it's really helpful because people it's hard for someone in pain to explain to someone who has never experienced chronic pain that doing a mild jog is incredibly scary for them. So
Hmm.
doing it with me, because this is what I do all the time,
Hmm. Hmm.
is it really reduces the fear and it reduces the self-judgment.
Hmm. Yeah. Yeah. And I think that's so important too, because like I said, I get a lot of people who say like, well, I used to run marathons and now I have trouble running a block. How is that important? But you can't get back to the marathons without doing the first block. And people miss that point frequently.
Right, right. And I think that that's for a lot of people who have become phobic of a myriad of things, there's this idea that, you know, say I'm a person who hasn't driven for a year, and then in my mind's eye, I'm thinking, oh my gosh, I need to go get on the 405 right now, one of the busiest freeways in California. It's like,
Mhm.
no, we want to drive around the block and do it enough so you're comfortable with driving around the block.
Mhm. Mhm. Right. And so let's talk about this idea of danger and safety. And so we're talking about that in terms of getting back to our frequent to activities that we used to be able to do with the concept of somatic tracking, making sure that we feel like these sensations in our body are safe. And what I say frequently to people when we're talking about pain is that pain is not evidence of damage in our body. It's evidence that our brain is sensing danger somewhere. It's not about damage, it's about danger. And
Mhm.
so, one of the big antidotes to the pain is being able to create this sense of safety. Now, that is much, much easier said than done in my
Absolutely.
experience.
Absolutely. So one of the things that you and I have talked about a lot, and I hear this very often from clients. Some people love telling themselves, "I'm safe," and they can buy into that.
Mhm.
Many people, though, don't believe that they're safe. Right.
Mhm. Mhm.
So what do we do with that? If we're telling ourselves, "I'm safe, I'm safe, I'm safe," then we're gaslighting ourselves, and
Mhm.
that's going to lead to us feeling bad about
Mhm.
ourselves.
Right, right.
So messages of safety. And I want people to have creative license to figure out how to embody that sense of safety a little bit more. So if I'm safe
Mhm.
isn't working, that's okay. You're
Mhm.
not doing it wrong. You just don't believe it.
Mhm.
All right.
Yeah.
So other options are I can tolerate this. This is temporary. And then one of the most creative ones that I've ever heard just came up recently, and I do have permission to use this. I'm not going to use the client's name.
Yeah.
Check this out. I love it. My body is fine.
Mhm.
My brain will align.
Say that again. My body is fine.
My brain will align.
Align. Okay.
Right. So it's kind of getting the body and the brain to kind of sync up and be on the same team.
Hmm. And so this idea of safety that comes up quickly when you work with clients, correct?
Yeah.
And what I say to people regularly when people say like, when people do really well with this, when people move forward quickly, what's the thread that helps them? My answer almost always is my patients who have done really well really quickly lose the fear
Right.
very quickly. So they
Mhm.
manage to figure out ways to create safety in places that it wasn't previously. And so how do you help people with that? And so say I come to see you and we're talking and this idea comes up, safety and danger, not damage. And I say like, I don't feel safe. I don't feel like or maybe what you said, right? I tell myself I'm safe, but I don't really believe it.
Mhm.
So how do
Mhm.
I start creating messages of safety that are believable?
I really like, I've been preferring lately, I can tolerate this, as evidenced by the fact that I already have, I didn't like it. I
Hmm.
hate it.
Hmm.
I was still able to tolerate it, right? So we're kind of combating that catastrophic thinking of, I'm never going to get out of this. It's
Hmm.
going to get worse. And this is the rest of my life. I'm going to be disabled. We want to combat that. So we're using the three C's there.
Okay.
And then there are times when the body gets so activated that the three C's aren't really available,
Sure.
right? As
Sure.
anxiety really rises,
Hmm.
we cognitively go a little bit offline and we get kind of stuck.
Yeah.
That's where we want to trust in the breath.
Hmm.
It's always going to be on your side, even if it feels uncomfortable. And
Hmm.
it will take minutes
Hmm.
to get the breath to slow down. But
Okay.
we're going to, get the heart going a little bit more slowly,
Yeah.
relax the body a little bit more. I've gotten really creative with messages of safety before.
Hmm.
If I'm safe doesn't work, if I can tolerate this doesn't work, this is temporary doesn't work. How about what am I good at? Right? So I worked with a client years ago where
Hmm.
none of those were, she's like, I don't at all believe it. Like, that's all bullshit.
Yeah.
I was like, okay, so what are you good at?
Hmm. Hmm.
She takes a moment. She goes, well, I'm a good gardener. So, okay, well, what are you good at gardening? Oh,
Hmm.
I have this beautiful tomato plant. And it's like, okay, that's going to be your message of safety until we can get closer to I can tolerate this.
Hmm.
I'm a good gardener. I'm a good tomato farmer.
Right. Right. And so let's unpack this a little bit because I think it's really interesting and I know how effective it can be. And so I'm safe. I mean, a lot of our clients have a lot of experience in not being safe.
Right.
Right? In a whole variety of ways, safe in their bodies, safe in their environment, safe in their families. And
Mhm.
so for a lot of our clients, there's a lot of past history that helps them understand that they're not safe. And then
Mhm.
we're now saying like, no, this is part of what makes you better is learning to create that sense of safety. And so what you said a few minutes ago that if you don't feel safe and you tell yourself you are, it's just the same as gaslighting yourself. And what I say is like our brains are too smart to believe something that's not true.
Mhm. Mhm. Mhm.
So a lot of people like that's the strategy they start with, which is, I feel safe, I am safe, but frequently that's not super effective. And so
Right.
you said next step is I can tolerate this.
Mhm. I
And
can
so
tell.
so tell me a little bit more about that, because I think one of the things you're saying is that that's a true statement for most people, correct?
Right. I mean, it's factually evident in that you're on the planet, right? You
Yes.
were able
Yeah.
to get on the other side of this.
Yes. And so tolerating to the extent that essentially it hasn't killed us, right?
Mhm.
And so we're still here and we're still doing this, and it doesn't necessarily feel good, and we don't necessarily want it there, but we are tolerating it. And so help me make the link here. How does that help build us towards feeling safer?
We're wanting to build resiliency.
Hmm.
So all of this this is a lot that goes into the first couple of sessions, and I'm talking a lot in the first couple of sessions
Yeah,
of
yeah, yeah.
what can you associate with feeling safe? Is there anything in your life, your dog? Does your dog make you feel safe?
Hmm.
Okay.
Hmm.
What about, having your screensaver be your dog?
Okay.
Really, really kind of getting to know someone on a personal level and
Hmm.
figuring out what are the things that help them
Hmm.
to feel specifically safe. If some of these broader, right? Because when we hear this on Uncurable and a lot of the literature and video content that's out there is you need to tell yourself that you're safe.
Yep. Yep.
Literally half the time,
Yep.
people come in and they're like, ugh. This does not work. This does not work for me. I don't believe that to be true. In fact, I know it to be untrue.
Yeah. And so hold that there. So I'm still trying to unpack this a little bit in my own mind too. So the idea, I'm tolerating it. It's not a direct measure of safety necessarily, but it's much more authentic. And so it
Mhm.
sort of brings people away from this idea that they have to tell themselves that they're safe and
Mhm.
reframes it like this is where they are in the process and this is a true statement about their experience. Do I have that fairly accurate?
Yes, right. Just that exactly right. That sense of authenticity. Like
Yeah.
this makes sense to me.
Hmm.
We're safe, maybe not.
Right. And
Tolerate, okay.
And then another step in this is that so you're reframing it and helping create authenticity in people's minds as they go through this process. And then you're starting to look for if you're not feeling safe in your body necessarily, like are there places where you do feel safe? And so that's where somebody's dog may come in, for instance.
Right, right. In EMDR therapy, we call that outsourcing the resources, right? So
Okay.
if right, so if we're not feeling safe in our body,
Mhm.
telling ourselves I'm safe, it almost kind of turns into like yelling at yourself, right? I'm safe. Like
Mhm.
calling it right, and that frustration starts to build, and now we're yelling at ourselves.
Right, right, which is never helpful. So, are there any other examples that you can come up with? So our dog, the screensaver, that's one. Any other
Mhm.
common ones you see where people start to recognize that there are some areas of safety in their lives?
This is one that I use.
Mhm.
It's a rose quartz heart
Okay.
stone, and I've had it for years, like decades.
Hmm.
And I just kind of do this really like I find this soothing to
Hmm.
me. It's a
Hmm.
self-soothing practice. And
Okay.
there are a lot of different self-soothing practices,
Hmm.
right? So it might not even be words. It might be touch. It might be physical touch,
Hmm. Hmm.
right? And when we put our hand on our heart, it is said to, you're the medical doctor, elicit some oxytocin that makes us, it kind of mimics having a hug.
Correct. Correct.
Mm,
Yes. And so when we talk about self-compassion, which we will later on, sort of the self-touch actually elicits that
mm.
as like you said, somebody else is giving us a hug.
It's
And
that hug.
then
And also we're making sure that we're breathing, that we're not up here,
yeah,
rise and fall of the chest.
yeah. And then you said earlier too, you sort of asked your patient what she was good at, and she said gardening. And so I'm starting to see how that's a part of this also. But can you unpack that a little bit more? So like why look for people's strengths? What does that do?
Mm. I mean, I think it makes them feel good. First of all, they like sharing with me because I'm not going to see their garden, right? I'm not coming over to their house. I'll never see it. So unless they take their computer outside and show me,
Mhm.
I likely won't. So they get actually pretty excited about telling me,
Yeah.
right? They've got this private garden thing going on and people largely don't see it.
Hmm. Hmm.
Oh, I'm really good at growing tomatoes. And in that moment, it feels good.
Hmm. Hmm.
We can come up with something that we know that we're good at.
Hmm. Hmm. And so you're starting to, and so I was thinking about what we've been talking about in terms of safety and exposure. And then so you're bringing people's strengths to light and helping them sort of essentially anchor in the good feeling of that.
Mm.
Good way of
Mhm.
putting that.
If you ask someone to list their strengths and
Yeah.
they say, "Oh, I don't have anything
Yeah.
that I'm strong at," but they know that's not really true. So
Hmm.
then I'll ask, okay, well, what would your spouse or what would your kids or what would your friends say? And
Hmm.
eventually we can get a really pretty good list going. And I think it just helps bolster confidence to be able to share that, to acknowledge that they know that about themselves.
Hmm. Hmm.
Other people know this about them too.
Right. And then do you ever have people who are shy about telling you their strengths?
Yeah.
And how do you work with them if that's the case? If somebody says, like you said, I don't really have any strengths, that's the whole problem, or I used to have strengths before I had pain and now I don't
Mhm.
thing anymore.
Well, I'll prompt people. Are you a pet owner? Yeah. Do you take good care of your dog? Yeah.
Mm-hmm.
Okay.
Hmm.
So
Hmm.
Do you like animals? Okay, so you're good to animals, right? There's a big compassionate space for animals.
Right.
Or do you like walking in nature? Oh,
Hmm.
I love the tall trees, and there's this meadow over here that I like. Okay, so you're a person who's connecting in with the earth.
Hmm. Hmm. Hmm.
It can be challenging to just, imagine me just sitting here and you asking my strengths, and I'm like, oh, I'm funny, I'm hot, I'm super smart. It's a little awkward.
Right. Right, right, right. And so it ties back into celebrating the wins too, right? Because one of the important parts of this is to recognize pieces of our recovery that seem small.
Right. Yes. So that's why we're still talking about messages of safety because we want to expand it, right?
Yeah.
So
Yeah.
people might start off with I'm safe, but I don't feel it. And I
Right.
want people to have a myriad of options of how I can message safety back to myself and
Yes.
be on my own side. So
Yeah.
I'm a good gardener is cool. It's a good brag, right?
Yeah. Yeah.
You feel
Yeah.
good.
Yeah. Yeah. And for those of us who aren't good gardeners, it's super impressive that people are.
Right, right. It's kind of like, my some of my friends are like, Erica's the best chef in the world. And I'm not. I mean, I'm okay. Like I'm pretty good. But in LA, most people don't really cook.
Right.
Everyone's going out to eat. So I can roast a chicken and people are like, this is the best thing ever.
Anything else about messaging of safety? Anything else that you think is important for people to uh,
Well, here, let's see if we missed anything. I know we're covering a lot of territory today.
Mhm.
But I
Yeah.
think messages of safety and self-compassion
Yeah.
really overlap. I mean, all of these pieces overlap, right?
Yes. Yes. And so let's spend a little bit of the time we have remaining talking about self-compassion, and then hopefully there'll be a few minutes for questions after that. And so there should be a question and answer button for those of you who are listening, and you can type your questions in, and we'll leave probably 10 minutes at the end to try to get at some of those questions. But you know, the three C's is about compassion, and the safety is about compassion, and recognizing our strengths is about compassion. And you and I have both seen lots of people who are extraordinarily hard on themselves. Yes. And I say this to people, and you know that I do, and you probably do sometimes too, that we can be mean to ourselves or we can get better, but it's very, very difficult to do both. And so when I said earlier that my patients who do well quickly lose the fear of the pain very quickly, there's also this compassion piece that if we don't learn how to be kinder to ourselves, then I think people can really struggle in moving forward. Because if we're talking about danger and we're talking about safety, if we're constantly being down on ourselves in our minds, that's not a very safe place
Mm-hmm, mm-hmm.
to be, right?
I love your visual. Mine was similar, but yours is better. So I'm gonna steal yours.
Yeah.
Imagine if someone's walking around like they're right behind you, chattering in your ear all day, saying, "Erica, you're not good at your job. You should have gotten that email out sooner. You really dropped the ball. You don't look very nice today." I'm gonna feel like crap very quickly.
Yeah. Yeah.
I'm imagining myself almost like crying. That would be so horrible.
Yeah.
But we do it to ourselves internally. No one's witnessing it. So
Mhm.
this is again where we can get stuck on that chatter loop. And we want to use the three C's to sort of intervene on our own behalf. But self-compassion is really just about can I be kind to myself? And I think most of us, especially like our generation and up,
Mhm.
was there was no space for compassion. That wasn't part of the story at all. The story was pull yourself up by the bootstraps and be tough and get out there and be successful.
Yeah. No pain, no gain. Wasn't that like the mantra
It's
of our teenage years?
totally no pain, no gain. Like how compassionate is that? It's just like, gosh. But most of us have learned that in order to motivate ourselves, we put pressure on ourselves. We've got to just work harder and do more. Blah, blah, blah. No space for compassion whatsoever. And part of that is that we have succeeded in the past from putting pressure on ourselves, right?
Mhm.
We got the
Mhm.
A on the exam, we got into college,
Yep.
grad school,
Yep.
whatever. And then we get to a certain point where the nervous system says, okay, this is like I'm hearing this constant chatter of
Mhm.
how bad I am all
Mhm.
the time. And
Yeah.
it could be smaller than that. It's not necessarily, Erica, you're a piece of crap. It could just be this kind of ongoing background noise of, ugh. I can't get everything done. I'm never going to get my to-do list done. Truth, you're never going to get the to-do list done. You cross something off and you immediately replace it with something else. So we've all got to be a little gentler with ourselves about that to-do list.
Especially in this day and age. And so you and I both see people come in and you and I have talked about it too, right? That sometimes when people say that like, oh yeah, I'm sort of hard on myself, it's like when we really unpack it, people can say really, really, really unkind things in their mind.
And have it on the it's kind of on the constant back here.
Yes. Yes. And
Yeah.
so similar type question to what I've asked you already. Like, so say you find out that that's a big part of what's causing people's pain and discomfort. How do you start to help them change that around? Or let me ask first, is that part of what you will do with people is work on the self-compassion aspect of this?
Absolutely. And I feel like you and I might have kind of like found our way into the self-compassion world roughly around the same time, maybe a little under 10 years ago.
That sounds
Um,
right. Yeah.
yeah. And it's one of the things that I love it when our brain is synced up, even when we're not talking. It's like we'll sometimes have like the exact same thought.
Yeah.
But so here's the very basic science version that I have here is so the amygdala is part of the process of the brain of going into a fight or flight mode, right? It's critically important to that. And fight or flight is really helpful if we're getting chased by a grizzly bear. It is not useful if we're trying to get our emails out, right?
Yep.
So when the amygdala lights up, it's not the amygdala's job to know who this messaging is coming from. It doesn't know if it's this person over here or this person in here. When we are continually being harsh with ourselves and critical with ourselves and pressuring with ourselves, that we're lighting up that amygdala, right? We're pushing towards fight or flight, and we want to go the opposite direction. So we want to move towards self-compassion, move away from pressure, away from criticism, right? So this is circling all the way back. This is partly why I have people track the wins, is that you're going to feel safer if you can acknowledge that you're doing things that are moving you towards health and healing.
And so for a lot of people, right, the self-criticism goes way, way back. And so what are the beginning steps for people? And so say, it's early on, you've seen somebody two or three times, and then this starts to pop up and you recognize what they're kind of messaging they're giving themselves. What do you do next? Like, how do you start to work with people to help them move towards compassion?
Well, I use with almost every single client for years now. Mindful Self-Compassion Workbook by Kristen Neff and Christopher Germer
Okay.
is so user friendly. Like, I'll say, I want you to do the first two chapters. Well, that's about 8 pages. And that's it, right? So we're just going to slowly move through where the resistance is to being kinder to yourself. And what's at risk, right? Oh, well, if I don't put this pressure on myself, then I won't be as successful as I want to be.
Right, right.
You will be in pain and
Yeah.
you will be miserable.
Right, right.
This compassion piece, it might actually be the most important part. And it's probably the hardest part, right? So with the 3 C's and that second piece is compassion, it is always the hardest part for people. They'll say, oh, I caught the thought and then I dropped into my breath. So, well, what was happening in between there, right? So again, all overlapping.
Yeah. And so, all right. So, the Mindful Self-Compassion Workbook, if Nirali can put a link into the chat, that would be great. But say it again, the names and the authors on that.
Kristen Neff and Christopher Germer.
And the title of it is just the Mindful Self-Compassion Workbook.
That's right.
And I think, when I've looked at it, it's got like 13 different meditations and 38 different exercises. And so I think that's important to recognize is that self-compassion is a skill.
Yes, that's very well said.
Yeah. And
Yeah.
so it's something, even if we're not good at it, even if it's a new concept, which I think it was for me at some point as an adult, we can still learn to go about how to do it. And, as I'm thinking about that, it was a new concept to me as an adult. Like there's, like I said, children of the 70s. And so it was all about harshness and you're on your own. And so I was taking class in somatic psychotherapy and taking a training. And so I had to leave town every couple of months for the training. And one time I was getting ready to leave town and I looked at my schedule in my office and I was totally booked for the day I was at the training. And so I immediately tried to blame my staff. I was like, I told you I was going to be out of town. They're like, no, you didn't. And so then I immediately attacked myself. I was like, how could I do this? Like, how could I be so stupid? This is like professionals don't do this, and I'm never gonna be a successful physician if I can't even control my schedule. And I had been learning, like part of that training was learning about self-compassion. And I specifically remember I don't know, 12, 15 years ago, I was sitting there sort of berating myself and I stopped. I was like, you know what? Like, we don't talk like this around here anymore.
Hmm.
Like if there's not something nice to say, then we don't need to say it. And and the process of doing that interrupted the cycle of me yelling at myself. And then it became clearly apparent, like, okay, like we're in this situation, we got to do something about it. And so, like 15 people on my schedule. And so the staff called some and I called some and like one person got kind of irritated and the rest were like, oh, that's no problem. We'll just switch it here. And the people I called are like, oh my God, Dr. Stracks, that's so nice of you to reach out and call directly. Like how that's so wonderful that you did that. And so, right, so that's an important first step, just realizing in the three C's that we're doing this and then figuring out some way to interrupt.
Right. And I've got my own self suit. So I've got my stone here.
Hmm.
And when I was growing up, we had horses. And so we took in this rescue horse. It was so sweet and beautiful, but had been abused and was just terrified. So we had
Hmm.
to move really, really slow with her. So once she let me touch her, their heads are super long. I would just pet her down the head until her eyes would soften. And I would just say, easy girl. It's really simple. And that's what I do for myself. If I get myself in that, like, oh gosh, kind of frazzly mode, which is, it still exists. I mean, I probably am not going to be able to abolish it. It shows up as part of my personality sometimes is to get into that perfectionistic way of being.
Hmm.
But as soon as I recognize it, I'll just do this. I'll just say, easy girl,
Hmm.
easy girl. So it's
Hmm.
like I'm talking to this really sweet, scared horse.
Yeah.
And
Yeah.
that's a technique that just kind of just like developed over time. It's
Yeah.
nothing wildly profound and it might not be meaningful to anybody else. But to me, this, like even just stroking my arm,
Yeah.
automatically I'm like, oh, that's right. I can be kind to myself.
Yes, 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 right. So just recognizing that's an option is such an important part of getting started with
It's
it.
huge,
Yeah.
right? It's such a
Yeah.
big part. And it's challenging for people. And
Without a
that's
doubt.
I
Huge.
mean, it's a long process. I think there are 22 chapters in this book, and we're just doing two at a time.
Yeah.
So that is weekly homework.
Yeah. And so anyway, so it's 10 till the hour, and there are a couple of questions that have shown up in the chat that I want to go over. There's probably more that we can talk about with the self-compassion, and so I think we'll pick up there with some other specific strategies
Mhm.
next time we talk about it. But that's such a critical piece of people's improvement. So let's take a couple of questions before we sign off. There's one message in the chat here or in the question and answer, that the chats aren't coming through. And so that may or may not still be true. If it is, we'll sort that out and we'll get all these links that we've talked about. We'll email them to everybody once we're done later today or tomorrow. So a couple of questions here. So I've noticed with high intensity intervals with the local running club that the sensations of pain in the calf and numbness in the foot became less on the second and third intervals when I focused on the sensations in my opposite leg or opposite foot or focused on the runner just ahead of me. Is that on the right track for the interoceptive exposure? It's a,
Yeah,
yeah.
yeah, that sounds great.
Yeah. It's doing a couple different things, right? It's taking our focus away from the negative and focusing some on the positive, or like you said, oscillating between one or the other in terms of noticing what doesn't feel good and then noticing what it does. But I think those are really good, just recognizing that we don't have to focus only on the negative sensations.
Yeah, that sounds great.
Yeah. How do you do the work with safety during times when the world is feeling less safe? It's such a
Oh,
good question.
yeah,
With
that's such.
violence, environment, viruses, and what is that, the impact of that context on our ability to feel safe through our in our minds and our bodies?
Yes, I mean, I think it's fair enough to say that in my lifetime, this is internationally the highest level of anxiety in the ether that I've been through.
Yeah.
So one self, I do not want to leave this out. I'm so glad you brought up this question, is limiting your content consumption, right? So
Mhm.
stop Googling your symptoms.
Mhm. Mhm.
It's got to stop,
Right,
right?
right.
I'm
I
putting
mean,
you out.
you and I have been talking a lot about the Googling our symptoms, right? And this question's a little bit different than that. This is sort of
Right,
the external world.
right.
But what I was saying earlier in terms of we can be mean to ourselves or we can get better. Like I'm starting to wonder if like we can Google our symptoms or we can get better, but sort of doing both is really difficult. That the Googling and the searching just constantly reinforces the danger of it. That's what the algorithms do, I think.
Right, and all of those the terrifying headlines that show up in the news feed. It's like they get scarier and scarier because they want clicks, and then you open them up and you realize it's nothing's really determined. They're just kind of throwing out this idea. The news is not great. I
Yeah.
really limit my news intake as
Mhm.
and I think of it in terms of capacity versus capability. I'm
Right.
capable of being on the news thread. Do I have the capacity for it right now? I'm
Yeah.
not talking about like sticking your head in the sand kind of thing, but really taking some, days of I'm just going to take a break from this because it's
Mhm.
not good news, right?
Right.
The good news doesn't really make headlines unless it's like incredibly well. But this all the scary stuff. So all of that scary headline and messaging is continuing to drive the volume up on the nervous system, right? We're
Right.
getting more and more dysregulated.
Yeah. I've been thinking about this concept, and you and I think have talked about this, that humans evolved in times of scarcity. And so the biggest place of scarcity is in food. And so our bodies are designed to eat as much food as we can whenever we get the chance to. And as long as food was relatively scarce, that was a really good strategy because during the summer, during times of harvest, we could eat and eat and eat. And then winter would come and there'd be less food. And so we'd lose those calories and expend the energy on staying safe during the winter until that process repeated. And that's a good strategy. But then, 50 years ago, food became plentiful rather than scarce. But our strategies are eat and eat and eat. And so we've done that and made ourselves sick by not knowing how to limit because we never needed to do that before. But the rise in obesity and the rise in diabetes linked to the switch from food being scarce to food being plentiful. And so now we all need different strategies in order to make sure we don't get sick. I heard somebody say recently that information is in the same category, that historically information has been scarce. So anything that we can do to get our hands on that, talking with people, getting information from other villages, or getting ahead on potential danger that was coming to see us, that helped us to stay alive. But then with the advent of the internet 30 or 40 years ago, all of a sudden we've switched before we could evolve for this to information being plentiful. And so now, if we consume as much as we possibly can, it's no longer particularly useful for us. And so we need a different strategy in order to make sure we're not taking in too much. Whereas in the past, like the danger was in taking too little.
That's an amazing way to put that. Exactly, right?
Yeah.
We have seen clients who are on a device
Mhm.
any moment in time that they're awake.
Yeah. Yeah. Yeah.
Right?
Yeah. Yeah. And younger generations even more so. And so figuring out sort of how to manage that and how to balance our need to look in other places I think is important. I'd say one other answer and then a couple more questions here. The idea of gratitude that looking for the positive in our lives and in our world. There's been multiple studies at this point talking about how helpful that is in so many different ways. And so making sure that we spend at least a little bit of time each day focusing on the positive, I think is super important.
Absolutely.
So next question here. If my brain is causing fascia and muscle tightness and sensitivity, and then it causes compensation patterns and misalignment for a year and a half, is that considered real or neuroplastic? And can I still get out of it? It feels like my muscles have been beaten all over.
Okay, that sounds like more of a you question.
I think that one of the places I see people get into when they're doing this work is what we're trying to do and trying to explain is that thinking psychologically about the pain frequently is more useful than thinking physically. And even when my patients talk about, okay, there's stress in my life and the stress is causing muscle tension, and the muscle tension hurts, right? It's still a way of getting into this physically based thinking. And so what I really encourage people to do is to think of these sensations in psychological ways. Where's the stress? What's going on in our lives? What's happened in the past? And try to leave more of the physical based thinking aside. And so, what I say to people sometimes is we don't have a tensometer. We can't like put a thermometer in our muscle and see literally how tense or tight it is because it will feel super tense and people will say like, oh yeah, every time I go to a massage therapist, they're like, oh my goodness, you got marbles in here. And so it scares us. But in reality, there are people whose tensometer is much higher who are walking around and feeling just fine. And so I don't think that the muscle tension and the tightness and the patterns is really where the issue is. But when we focus on that, we miss the opportunity to see the psychological parts of it that are causing issues for
It
us.
sounds like possibly the person that's posing the question is doing some of that back and forth. Is it
Mhm.
structural?
Yep.
Is it right? And this is when we start getting into problem solving,
Yeah.
which is a great trait when it is necessary, but can be somewhat problematic when we turn ourselves into an equation that
Yeah.
we're trying to solve.
Yes. Yes. Right. Because what do you say, right? You're not a problem that needs solving, right? We're not problems.
You're not a problem to be solved.
Yes. And so it's top of the hour. So last question, and then you and I will sign off. Person said one thing you really resonated with is that, or she resonated with, is that the to-do list is never done. So, zero unread emails, and that would be great, but it never ends. Like, how do you overcome this? So, self-employed, she can never clock out, and so the emails always stress me out. How do you address that? How do you let yourself live in this world where the tasks are never done?
You kind of have to just be okay with it. I mean, it's taken me a while. I love to-do lists and I love press. I will put like even super small things on my to-do list,
Mhm.
like, you know, brush your teeth or something like that. Because I
Take
love,
out the garbage. Yep, take out the garbage is on my to-do list.
yes, yeah. It feels so good, to get beyond that. But it just won't, it's not going to end. So I have some rules with myself about things.
Hmm.
Is that once I leave my office,
Hmm.
I'm not allowed to think about work.
Hmm.
This
Hmm.
is not easy, but I trained myself this way so
Hmm.
that I have to, if I start thinking about like a case conceptualization or something, I have to come back in my office.
Hmm.
And
Yep.
my office is my
Yep.
least comfortable room
Nice.
in the house.
Nice.
So I want to be out there,
Right.
but I can only be in here if I'm thinking about work.
Yeah. And I think the self-employed part is important too, right? Because you never clock out, the work never ends. And we talk more at some point about sort of the informational age versus the industrial age. But supposedly there was a study in the early days of the internet where they put up two websites that were identical for a consultant. One of them said, contact me here for information. The other said, contact me here for information between 9 a.m. and 5 p.m. or by appointment. And so which of those got more clicks, do you think?
Probably the appointment.
Exactly. The one that had some limits on it got more clicks. And so people, I think, respect limits, people admire limits. And when we put those limits in there, we do a couple of things. One, sort of the clients who are important will understand that the limits are important. And frequently people will be like, oh, yeah, I should do that. And sort of knocks out people who have unrealistic expectations too, that like none of us need to be on call 24 hours, 7 days a week. And I know that the world works that way, but that's not good for our mental health and it's not good for our physical health. And so boundaries, which we haven't really talked about yet, but isn't a hugely important part of PRT, is useful here. Sort of thinking about where we want to put the boundaries and how we put them in place so as not to offend people, but to take care of ourselves. And then as we take care of ourselves, we can better able to take care of other people too.
Mhm. And I think that just strategy wise, if this person has been someone who really does kind of feel like they're on the clock 24/7,
Mhm.
is starting to initiate boundaries. Just
Mhm.
starting off with your clients. Hey, I'm actually shifting to do things a little bit differently, and so my working hours are going to be X and X, and
Yeah.
I'll be off on the weekend, but I'll get back to you between these hours on Monday,
Yeah,
Tuesday.
yeah, yeah. And certainly as we continue to unpack parts of PRT, that would be on the list to discuss. But yeah,
Absolutely.
so anyway, we're a couple minutes past the hour, so we will end here. Erica, thank you so much
Oh, thanks so much for having me.
being here. So much fun to talk with you about all this. We'll be back in another month or so in early July to talk more. Thank you to everybody who's here and listening. If you're interested in working with Erica directly and seeing how PRT can help you or how her expertise can help you, just go ahead and reach out through our website, cormendyhealth.com. We hope to see you all back here next time we do this in July. If anybody's in the Chicagoland area, wants to come to Dr. Schubner's book signing on Friday, we're more than happy to host as many people that want to come. And we'll email out all those links that may or not have got to you guys. So, Erica, thanks so much. Thanks to everybody who's watching, and I hope everybody has a great rest of their week.
All right, thanks so much. Bye, everyone.